and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. So let's start with the first one, and this one is from Huron, and it has nothing to do with allergies. It says, discuss bleeding from the urethra, but no blood in the urine. Anything allergic? And the answer is, I don't like bleeding. So that needs to be looked at. You need to go to your general primary care doctor or to the urologist and get it looked at. And so that's an important question. Thank you for calling. And if it wasn't allergies, we still could answer it. Here's from Sioux Falls. Do allergists work with immune system disorders? Now, you do. What immune system disorders can we talk about? We talked about celiac earlier. That's an immune system disease.
Right, and we share that with the gastroenterologist. And probably the most common immune system one is urticaria or hives, outside of obviously allergy. So that's the most common one.
The chronic urticaria.
Right. We have the rheumatologist doing primarily the rheumatoid-related diseases such as lupus and rheumatoid arthritis. We probably do as much primary immune deficiency as anybody. In Aberdeen, I do all of the
For example?
Immune deficiency. That would be a person who, when they come in, they have repeated infections. We measure the amount of antibody that they're producing. It's below a certain standard. Usually it's more than one of the antibodies that qualifies for the diagnosis of common variable immunodeficiency.
And you treat it with shots of immune?
IV or subcutaneous replacement of the G part of it. The M and the A we can't replace.
And how expensive is that kind of therapy?
Oh, it runs
someplace
about
between $30,000 and $65,000 a year.
Right. Or they're in the hospital with pneumonia and getting repeated ICU pneumonia, eating their lung. I mean, this gets to be, or GI tract.
COPD from it. So it's really changed those folks' lives. They lead fairly normal. You know, they're working, they're having families.
I know a physician a pediatrician who had to get out of the business because of immune system disease.
And one of the things, so we work with that. There is a little specific group of people who are missing IgA, and they have a lot of rheumatoid disease and a lot of allergies.
And there's nothing you can do for that one.
Yeah, treat the symptoms.
Infections you treat.
At Madison, there is a correlation between Barrett's esophagus and allergies. Is there? Barrett's esophagus meaning that chronic reflux going up into the esophagus, irritating the lining, the lower part of the lining of the esophagus, and it turns into stomach tissue.
I don't think we really have enough years of following the eosinophilic esophagitis patients. That would be where the allergy could play a role.
Yeah.
So far, my understanding is that it probably doesn't have as much as just plain reflux has on it. That it's like people with allergies, I think, actually have a lower incidence of cancer overall.
There's something,
and so there is something about having an allergy that's protective.
No, I haven't heard that one. That's an interesting comment. Cough is terrible. I take Advil for years. Is there anything else to take? I'm thinking if they're taking Advil, which is ibuprofen, it can cause reflux, which can cause a cough. But I'm thinking they meant Advair. Yeah. What is Advair?
Advair is a combination medication of a bronchodilator that's long-acting and an inhaled steroid. And it's really one of the great breakthroughs because we had so much difficulty in getting people to take the steroid portion of it, which is the good part for relieving the inflammation in the lung, because they'd be just using their bronchodilator and getting immediate gratification. So we put them together so you get the immediate gratification and you get the medicine that we want. Yes, exactly.
It's a trick to get them to take their steroid.
But a cough on Advair means there's another cause. Cough is first or second coming into your primary care office. So there's a lot going on. We've talked about reflux and
nasal drainage, allergy things.
Exactly. So that's a good one to go in and have methodically taken care of, particularly if you're on Advair and still coughing. That tells us that either your asthma's out of control or there's a second cause, and the one that you've been talking about, reflux, is a common one.
So what is the most unusual cause of a cough that you've discovered, Mark?
I think the most fun one I saw, my aunt sent me a picture of the needle in the bronchial tube.
And I had a
Those
fish,
are bizarre.
and I had a fishbone.
And you've had a fishbone in the bronchial tube. That will cause a cough.
Those would not be fun.
No.
Actually, this fishbone is right at the vocal cord. It's stabbed right in the vocal cord.
That
So
reminds
watch whoever's cleaning your fish.
I've had 2 patients who presented with abdominal pain that had toothpicks in their colon, but that we're not talking allergy. I'm sorry, I had to just bring that up. Had
I
terrible.
thought you were going to go with a wood allergy.
Yeah, that's right. Had a terrible allergy as a kid. Went to cancer. Went to camp and smoked some marijuana. Now he can walk through ragweed without any problems. So we went to Colorado.
Right.
Or Canada, one or the other. I think Colorado, yeah. Went to Colorado, smoked some of the marijuana. Now we can walk through ragweed without any problem. Any data on marijuana?
I think that those would be completely independent events, not cause and effect.
Right.
And we could get very jovial about
Well,
this because there's a lot of because just like anything else, if you want marijuana to work, by golly, it'll work.
And you may have had just as much suffering, but you don't remember.
We know that a bunch of people outgrow their allergy, atopic things, and I'd want my patients to get done earlier than later.
Yeah.
And a lot of time as physicians, as allergists, we always remember there's a placebo effect to any therapy that we institute.
Of course, even if you're not an allergist, that same problem or reality occurs, and you hope that they get better. And if you hope hard enough, sometimes that's also very helpful. Letcher, South Dakota, allergic to dyes in foods and annatto in ice cream. Discuss this. Annatto. You know what annatto is?
Yes.
What is that?
It's a
nut.
No. Well, annatto is used as a coloring agent.
Oh.
And it is a protein, and you can be allergic to annatto.
Okay. And dyes?
Carmine is the one dye, the red dye. And yes, you can have this. This is a very specific allergy. It's not just every red dye and red dye FDA, red 14 and this kind. It's a specific dye with a specific, you can skin test this now. Getting carmine to skin test it, now there's a problem. Annatto's difficult to do, so sometimes you use some food that has, you look up on your Google annatto, find something that's got a lot of natto in it, and use that as a direct challenge to it, and so we can do that. But that requires. Usually, we'll talk about something like that, saying,
"Call your buddy."
That's a.
Once you are lucky enough to figure that out, then it's avoidance.
It's just And the question is, it isn't the red food dye 13 or 14 or whatever.
I've forgotten what carmine is. It has a number.
Does it?
Yeah.
All right. Any other comments about red food dye? And if you did a skin test with red food dye, would it leave that red color in your skin forever like a tattoo? No. Okay. Sioux Falls, what can be done about the dry, itchy eyes associated with allergies? That's the steroid nasal spray, right?
I usually start with, there's an over-the-counter called Zaditor. It's ketotifen. That's pretty effective.
Over-the-counter anti-allergy eye drop.
Right. Ketotifen is an anti-inflammatory. It kind of falls between a non-steroidal and it's got an anti-inflammatory. And then Cromolyn, is it still available as an eye drop? Over the counter. It used to be. That's a very good one over the counter because you could get
People use the Zaditor nowadays.
And the thing is
Zaditor.
Zaditor or ketotifen. Neither one's a memorable name, so it makes it hard to remember. I mean, my patients call the office from the pharmacy, and I said, "Well, ask the pharmacist. He'll show you where it is." But the thing is that we can put a drop in your eye at 30 times any dose you could ever take orally. So it's very effective in the eye. Now, we do have antihistamine eye drops. Now, one of the problems with antihistamine eye drops, the same with Zaditor, is it's drying, and you already got a dry eye, so you're a bit have to rob Peter to pay Paul.
I think I've got to put this in. If you have allergy eyes, I want to hear they're watery, and I want to hear they're red and itchy. And if you're talking dryness, I'm thinking dry eye syndrome. And sometimes it's a burny, itchy sensation with that.
Good.
And so is it really allergy or is it a dry eye syndrome? And if you put in the allergy eye drops, you're going to make the dry eyes worse.
So if you put in for the dry eyes just methylcellulose or liquid
And you can
tears.
actually do a test for dry eye called a Schirmer's test. You put 2 little pieces of paper in there, and it has a, if you tear less than 5 millimeters, then you have dry eye.
And if the regular eye drops and the nose sprays don't work, I think that's where the allergy shots often are put in, because I swear the eyes are the hardest to treat.
Absolutely, and the skin tests tell you if this is an allergic person on top of dry eye. So skin testing diagnostics, very important
helpful.
in this. Yeah, exactly.
That was a more complicated answer than I thought I was going to get.
They're always more complicated.
Yeah, well, yeah. What can be done about lichen planus rash, and it is caused by an allergic reaction?
Dermatology.
Yeah, it's really not, allergy testing isn't going to help you on that one.
No, it's an unusual rash, and
no fun
it is no fun, and I don't think it, but it's generally self-limited, isn't it? Not, but I can't remember.
But our derm guys just do an awesome job with this. This is kind of their bailiwick when it comes to the tough
And
diseases
some
to
people
treat.
find certain things or exposures make that worse, and so that's more of a trial and error. Our tests aren't going to help you with that.
Okay. Is the late 1960s caller reacted, in the late 60s, the caller reacted to sulfa with joint pain. She has been told that the new sulfa drugs might not cause this reaction. Should she ever use sulfa again?
So drug hypersensitivity. We
Right.
get to see a lot of patients with drug hypersensitivity. This is
Sulfa is a very
obviously
common.
right, and this is not an allergy. Because why? Because you didn't give me a mast cell mediated problem. You gave me joint pain. Very nondescript. Was the sulfa treating something that gives joint pain, like strep or something like
Right.
that?
And
So
when you
that's-
killed the bug released parts and gave you that rash,
So-
or that joint problem.
joint aches.
This is just joint pain. So
Yeah.
that I can't.
Wow, that's a very good answer.
Right.
You know, you
So-
could have said, "Yeah, you'll always have it." My question is, though, people who have a rash from sulfa, that's an allergy.
Not necessarily. Because Stevens-Johnson is not mediated through IgE, it's mediated through a T cell mechanism, and it's a wicked disease.
Or
So
it could be that the viral infection that was being treated
Treated
with the
sulfa.
sulfa caused the rash, or there's a whole bunch of other things, and we don't have a blood test or a skin test that can find an IgE allergy mechanism to sulfa.
But if they have an urticaria rash,
No, we can't find so far an IgE mechanism for this. It looks like it in certain cases, but there are lots of other things that give you hives. Quite frank, that's one of the talks that we end up with all our residents and students. Strep throat, that'll give you hives. Viral things give you hives. There's a lot, just taking the drug and killing that stuff will give you hives.
one of the most common things that I still do is the hospital calls and says, we need to give a certain antibiotic, and they're allergic to it. So I go over and take a good history, and I haven't found an allergic person yet. I'm sure they're out there, the real thing, like the guy that you got, but typically they don't. They have, so what I do is give them a little tiny dose and just build it up so that they tolerate this antibiotic that they must have.
Yeah.
I will, if they have to have sulfa for some reason, we can do an oral challenge in the office and take care of the allergic response, if you have one. Almost never happens.
But some of these real dangerous ones where all your linings of your mucous membranes slough off,
yeah.
that one you can't desensitize, or a lot of these where the joints just kill you, that one may not be desensitizable. You may get that, and then you have to decide, is the disease you're treating so bad that you're going to need to treat through some side effects?
right? So you give them the steroids and the antibiotic if you have to, if it's a life-threatening scenario. Here's an 85-year-old. Can a person be allergic to nitroglycerine? I think he's having the reaction to the nitroglycerin with this flushing feeling, and it feels like I'm having an allergic reaction, but it's the nitroglycerin that's doing it. Yeah, it's a vaso. I used to have all of my med students take a nitroglycerin just to see what it feels like, because it's this flushy, kind of a whew, and sweaty, and you get lightheaded because your blood pressure, you vasodilate and your blood pressure drops. So you got to be ready to have them, lay down if they have to. But it's and it's quick and it goes away.
Right, and if you happen to be a person who has some mast cell mediated issue and you vasodilate them, sometimes they get itchy. That happens sometimes with our people who say, well, every time I drink alcohol I get itchy. Yeah. Well, you're vasodilating, and because you tend to have some mast cell
floating around,
then you end up having some histamine.
But you're not. But it's not an allergy.
No.
Wow. Here's from Howard. Caller is allergic to tape. What is in tape that causes this? Her daughter also reacts to tape. What can they do for this problem?
Find a tape they don't react to. They make very many. Well, there are a lot of different tape that are not as reactive,
less problematic.
Yeah. So
experiment.
Yeah, it's a challenge.
Okay, you're not going to give them any straightforward answer. Just try a different.
Everybody's different.
Right. Here's what we would do in the office. We would have, and you're going to pay for this, but you could do at home. Is we take the tapes and we put them on your arm, and we tell you to come back in 3 days, and we take them on the, that one didn't react. Well, okay, and you pay me for doing that. That's fine, but you really could have done that at home.
So go home, find a bunch of different types of tapes,
just put them on,
and put them on and see what happens.
Yeah.
Look at them in 3 days.
Right, exactly. Well, most of them, if you're reacting, you'll have it off in 1 day or shortly.
So this is the last question. I want to again say thanks for your help tonight. Put a UV light in air vents. This helped with allergies a ton. Is this common? Do you recommend it? There's these filters you can buy that take away the allergies. It's sort of the dust mite allergy, kind of a filter, UV light kind of a thing.
I've never read anything that suggests that UV light would be beneficial in regards to allergy. You could get.
You've read a lot of things, and you've never read.
There's this. Well, what causes me a hesitation is there's this. If you are living in a situation that has a lot of bacteria growing because it's too moist in your home, and you've got food laying around, and it's a hostile environment in that respect, UV light would reduce the amount of living bacteria that you're inhaling, but you're still going to be having an environment that is very negative. And one of the things that I see is people do, we were just talking about this today about environmental controls. Do they work? And when your environment is clean and the humidity is good and that kind of thing, you're just healthier. It's a healthy environment. And when there's too much humidity and it's not very clean and there's a lot of dust and there's a lot of circulating antigen and that kind of thing, you're not particularly, but you don't feel very good under those circumstances. And so I think the UV thing probably doesn't have any direct correlation. Do you think it has any direct correlation?
I don't know how. I think it brings up a wider discussion, though, that most filters don't have a lot of evidence that they're going to help the allergic part. Just like if you own, it's just not enough to get all the allergen out. By definition, an allergic person needs hardly any of the substance to have a terrible reaction to it. And so you have to do a lot of things to decrease the exposure low enough. And most of the time, we just don't have that technology.
But you guys sure talk about closing the doors during allergy seasons, or the windows.
Easy. Close up your house, and air condition drops up to 70% of the pollen.
But it still comes in the door.
Yeah.
Not very many people have a positive flow in their home.
Yeah.
If you open your door of your house and it swings open, you're going to have less pollen come in. If you have a negative pressure house and you pull the window open, it sucks everything in. It does just that, sucks everything in.
And so if you decrease the exposure by quite a bit, use your nasal steroid, use a little antihistamine, life's a lot better than if you're just inundated with huge levels.
And so that's your recommendation rather
So it
than the
helped.
UV light.
And can I go one more step?
Sure.
And Mark and I have talked about this before. It is very difficult to get your environment, even your personal environment, down to such a level that you're not going to have a problem. And where are you going to go? Are you just going to sit in your house for a long period of time? No.
Yeah.
So this is why immunotherapy is so important in what we do, because now you can go anywhere and do things that you weren't able to do rather than trying to control your environment.
They just came out with data that said that the people that taking shots pays for itself. And then that's what you're talking, immunotherapy, the allergy shots.
Yep.
It pays for itself and you feel better.
It's less expensive in the long run, and you have a life.
And they did a tough group. They did Medicaid population in Florida, and the statistics were overwhelming. I mean, for medicine, it was impressive.
Neat thing. You guys were happy as a lark when you read that one, and I have to say, speaking of happy as a lark, how happy I am that you guys joined us. Thank you so much. This is great. And thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Be sure to join us next week on South Dakota Public Broadcasting at our regular time, and call in or email your questions. And until next time, stay healthy out there, people.